I don't understand how a pelvic floor therapy group cannot know about pudendal neuralgia, but yet they perform and do pelvic floor physical therapy. All right, everybody, another episode of Daily Doc Talk. So I was talking with somebody today. I had a 15-minute discovery call where I see if I'm a good fit and if the patient's a good fit for me for the therapies that I do. And this potential patient was potentially suffering from some pudendal neuralgia. And so we were discussing this, and one of the things that I said really kind of sparked this idea that I want to talk about. So I had told them that, if you haven't, going and getting an evaluation and potentially working with a pelvic floor therapist is probably a really good idea if you think you have something like pudendal neuralgia, because that is within the wheelhouse of a pelvic floor therapist, and you might be able to avoid injections and things like that because patients can, do really well with pelvic floor therapy. And the patient had told me that he was scheduled in the future for a consult with a pelvic floor therapist. But he said that when he had talked with them that they didn't know what pudendal neuralgia was. And I was really taken aback by this, because pudendal neuralgia, for those of you who don't know, is where you can get pain, numbness, tingling in the genital region. You can get it in the perianal region, and you can get it kind of in the inner thigh. But predominantly it's in the pelvic floor. So I hope you're catching on where I don't understand how a pelvic floor therapy group cannot know about pudendal neuralgia, but yet they perform and do pelvic floor physical therapy. So I said to them, you might want to call around and maybe look into working with another group, another pelvic floor therapist that knows about pudendal neuralgia, because it actually is, while it's not a common diagnosis, that is something that a pelvic floor therapist should know about. And so where I'm going with this is that if you are considering, working with somebody, whether it's with us, with somebody else, you want to make sure that you have a discussion with them to kind of gauge, what their level of expertise or exposure is to a particular diagnosis or set of symptoms and things like that. Now, obviously, you could always come across people who oversell, their expertise and things like that. But I think for the most part, everybody generally cares about their reputation, and they're not going to lie to you. So if there's something that I have never worked with before, I'm pretty open and honest with patients to tell them that, or if I have limited experience, or if I have a lot of experience. And so, if, for example, you are looking for some help with some cluneal neuralgia, so some superior or middle cluneal neuralgia, and you're going to go see somebody who does injections, it's good to call them and find out, is this something that you've treated before? How many procedures have you done? How many times have you diagnosed this? Can we talk about this? And I think that's really, really important when we start moving into this model of healthcare where patients are now seeking out care for certain things because they're not happy with the care that they're getting in the conventional system. They've been told that they've got discogenic pain, or they've got degenerative disc disease, and that's your back pain, and just deal with it until you need a fusion. When, they're like, oh, well, maybe it's something else. Maybe I should go look into this. You can't just go back to your doctor and say, listen, I know that you told me to just wait around for a fusion, but I'd like you to evaluate these cluneal nerves. They're going to be like, the cluneal nerve. One, they might not even know about them because that has been so long since they were in med school and probably learned about them. Or two, they probably are going to dismiss it because if they thought it was something, they probably would have brought it up or addressed it earlier on. And so if you're considering working with somebody new, call them. Try to figure out, do they work with this type of condition? How many times do they, work with these types of patients? Those are questions that you want to ask, because you don't want to, only work with the people who specialize in that, because that can sometimes be a problem. That can sometimes limit our field of view too much. So if you go to somebody, let's say using our pudendal neuralgia example, who all they treat is pudendal neuralgia, and you're not sure if you have pudendal neuralgia, that may be good, but it also may limit you in the sense that what if there is something else that's contributing to the pudendal neuralgia? So as an example, sometimes we can actually see instability in the sacroiliac joint that can contribute to or even cause the entrapment of the pudendal nerve between the sacrotuberous and the sacrospinous ligaments. And so in our workup and evaluation, if we diagnose pudendal neuralgia, I want to know, well, why is that there? Is there an entrapment in Alcock's canal? Is there an entrapment between sacrospinous and sacrotuberous ligament? Why is that there? I will then go further and even look at the myofascial chains or the myofascial meridians to look upstream and downstream along the back, in the neck, in the feet, in the knees, everywhere that could connect, try to understand why this is happening so we can not just treat the symptoms, but also go deeper and treat the root cause. Now, sometimes you can get that if it's someone who's really specialized, but sometimes you don't. And so in some cases, seeing the pudendal neuralgia person might be the best thing for you, but sometimes it might not be. So I'm not trying to sway you either way. I'm just saying, consider that when you are trying to evaluate who you should see and things like that. So just something to think about. Please make sure that you are doing some due diligence, trying to talk with people to understand what they treat, why they treat, how much they treat, so that way you can hopefully get good healthcare that is directly focused on what you may or may not be dealing with. See you later.